Welcome back. Today we continue our discussion on lower limb and we are going to focus on the knee joint. Starting from the lower third of the femur, let's try to orient yourself. We are looking at the right limb and we are now at the inferior third of the thigh with the bone, the femur here in the middle. The whitish is the bone marrow inside of the bone and the hyperdense cortical layer. It shows us the compact bone. Remember, the bones are hyper intense on the MRI images. This is not the CT, it's an MRI. The muscles which we have on the lateral side here are the vastus lateralis, the vastus intermedius, and behind here are the short head of the biceps femoris and the long head of the biceps femoris. On the opposite side, on the middle side, we have the vastus medialis, this wide muscle which occupies the middle side here, the rectus femoris, and this muscle here anteriorly, and just behind, slightly behind here, you can see the sartorius, the gracilis, semimembranosus, and semitendinosus muscles. You see, we are at the upper level of the popliteal fossa. The popliteal artery and popliteal vein, they are already behind than the femur bone here. So that means that adductor muscles, they are all left above as they insert at the high level to the linea aspera of the femur. So we do not see any adductors at this level. Okay, as they scroll down, you're going to see how our popliteal vessels approximate to the posterior surface of the bone, and at the same time you see how the tendon of the rectus femoris, it joins the tendon of the vastus intermedius and makes the quadriceps femoris tendon. So this thick, hyper-intense structure in front of the femur here, it is our quadriceps femoris tendon. As I scroll further down, I can see some widening of the lower part of the femur. We are at the level of the medial and lateral condyles of the femur now here, and you see they are not absolutely similar in shape. The lateral condyle, it protrudes slightly forward here, and another piece of bone appears anteriorly with a beautiful articular cartilage on its inner surface. This is our patella in all its beauty. We have intercondylar fossa behind with the oblique popliteal ligament running through it. Just to remind you, this ligament is an extension of the semimembranous tendon, which is right here, this hypo-intense line here. This is our tendons of semimembranous muscle. And the rest of the muscles here on the back of the femur, it belongs to the gastrocnemius muscle, the lateral head here, and the medial head of the gastrocnemius. The short head of the biceps approaches the lateral head of the gastrocnemius, and on the opposite, the medial side here, you can see the termination of the sartorius, this tiny piece of muscle. Well, let's look at the other ligaments which we see here. This dark spot in the middle of the intercondylar fossa, it represents the anterior cruciate ligament, and on both sides of the knee joint you also see some darkenings, right? These dark areas, they show us where the tibial collateral and the fibular collateral ligaments are located. The other ligaments in front here are the medial and lateral patellar retinacula. As you understand, the knee joint is quite movable and it may be injured easily. If we see any signs of edema in the area of attachment of one or another ligament around the knee joint, this is important for diagnostic and proper treatment. Remember, the two images, they allow us to see it. As they scroll further down, we can see the infrapatellar fat pad, always hyper intense area in front here, filled with fat. This is the infrapatellar fat pad, and you also see this oval-shaped structure which extends down from the lower part of the patella. This is the patellar ligament. And at the next image here we can see all the intrinsic structures of the knee joint. Beautiful medial and lateral menisci. Each one has the anterior horn, the posterior horn, and you can see the transverse ligament of the knee which connect the anterior horns. And just behind it here inside we have the anterior cruciate ligament and the posterior cruciate ligament. Some other structures, they also come to very close contact to our menisci. You see at the lateral side here we have the tendon of popliteus muscle which comes here to attach to the lateral meniscus. This muscle participates in the unlocking mechanism of the knee. And on the opposite side, on the medial side, we have the tibial collateral ligament which runs downward and attaches to the capsule and to the medial meniscus. And this ligament is commonly involved in the unhappy triad. You remember the pathology which includes three traumas in one: the anterior cruciate ligament, the medial meniscus, and the tibial collateral ligament. They have tendency to rupture together in sports. Scrolling down, we're gonna see the articular surface of tibia. You see these two shallow fossae, the tibial plateau, and this is the level where we can evaluate the proximal tibio-fibular joint. You see one tiny bone appears on the lateral side. This is the head of the fibula, and this grayish area between the head of the fibula and the tibia here is our proximal tibio-fibular joint. This is the synovial joint, so you see the cavity inside, and it is reinforced by two ligaments, the anterior and posterior superior tibio-fibular ligaments. You have heard a lot about the relationships between the neck of the fibula and the common fibular nerve, and now we can see how closely related these two structures are. The common fibular nerve is just behind the head of the fibula on this image, and as I scroll down you can see how head of the fibula continues with the neck, the narrow part, and this is the nerve. You see the whitish structure in front of the neck of the fibula. This is our common fibular nerve, so it just runs in front of the neck of the fibula. They're really very closely related, you see. At the coronal images, the first bone which appears is of course the patella, and you see it right now. The base of patella is above, the apex of patella is below, the duct tissues attached to the base is our quadriceps tendon, and of course the dark tissue attached to the apex is our patellar ligament. Well, as we go further deeper, we enter the cavity of the knee joint, and at this image here you see the infrapatellar fat pad, this whitish area, and the suprapatellar synovial bursa. You know, if we have any infection here, the arthritis, the suprapatellar bursa is the one which will accumulate the excessive fluid and appear extensively bright at the two images. You see some muscles around. This is our vastus medialis on my right and vastus lateralis on my left. The darkish area between them is the tendon of quadriceps femoris. And you see the other components of the hip joint, the distal end of the femur with two condyles is appearing above, and the upper articular surface of the tibia appears just below. Here they are. As they approach each other, you can see the other structures around. The medial meniscus is appearing right now between the medial condyle and the medial tibial plateau. Here it is. And on the opposite, on the lateral side, you do see the iliotibial tract or iliotibial band, this dark line running down and attaching to the tibia laterally. The lateral meniscus appearing on the lateral side as well. So you see, as well as the acetabular labrum, the medial and lateral menisci, they have a triangular shape and they are absolutely hypo-intense. They are dark on images. Well, you can appreciate the close relations between the medial meniscus and the medial collateral ligament, also called the tibial collateral ligament. You see how it comes close to the meniscus and attaches to it. And on the lateral side, you can see the popliteus muscle and its tendon as they attach to the lateral side of the joint capsule and to the lateral meniscus as well. Well, the other ligaments we have here too, right? Just between two condyles, we have the anterior and posterior cruciate ligament. So here they are. The anterior cruciate ligament is a little bit in front, the first dark spot in the middle, and a little bit behind there we have the second dark spot. This one belongs to the posterior cruciate ligament. Well, I would like to point your attention to other tendons which we have around, because they all are clinically important. Each tendon may be inflamed and may give some pathology and pain at the knee joint. Okay, at this level, have a look at these three tendons on the medial side. 1, 2, 3. Do you see these three dark dots? This is our pes anserinum, the goose foot. These three tendons, they belong to the sartorius, gracilis, and semitendinosus. Remember, they all come together to attach on the medial side of the tibia. So here they are. And let me scroll back forward. Anteriorly, on the lateral side, you can see the tendon of the biceps femoris. Here it is. This is the tendon of the biceps femoris, as it comes to attach to the head of the fibula. And at the same level where we have the head of the fibula, you can see the fibular collateral ligament, this dark band here, which extends between the lateral condyle and the head of the fibula. But as you see, it has some space between the meniscus, the lateral meniscus, and the ligament itself. We have some space filled with connective tissue which appears like a whitish space between them, so they are not attached. At the sagittal views, it's quite useful to be able to recognize the head of the fibula. Here it is, this tiny piece of bone below. It shows us that we are looking from the lateral side to the medial side. The proximal tibiofibular joint is in focus now, here in the middle, and you can see some dark lines here all around, right? The one which is behind belongs to the biceps femoris, and the one which is in front here, this is the iliotibial tract. And between them you can see one more tiny band. This band is the fibular collateral ligament. So 3 tendinous structures are in front of your eyes right now. As we are going from the lateral side toward the medial one, you know now that the meniscus which appears just on top of the tibia is the lateral one. So the anterior horn and posterior horn of the lateral meniscus are in the middle of this picture right now. Just behind you can see some muscular fibers here. They belong to the popliteus muscle, as it comes here to attach to the joint. You can see clearly the infrapatellar fat pad here, just under the patella, and the suprapatellar bursa, this grayish sac just behind and above than the patella. Two beautiful tendons, the quadriceps tendon and the patellar tendon, bending the patella to the knee joint above and below. And posteriorly you do see the biceps femoris above and the lateral head of the gastrocnemius muscle with the tiny plantaris longus muscle. Well, let's reveal the internal structures of the knee joint. Just in the middle here now you see the anterior cruciate ligament, this beautiful band of connective tissue you see right here. Well, and the second dark structure behind there is the posterior cruciate ligament. So here they are, this is the anterior one, and on the next image here, this is the posterior one. The two vessels which you see just behind and the knee joint, they are our popliteal artery and vein. You remember the artery is closer to the bone and the vein is more superficial in the popliteal fossa. Well, and we are going to the medial side. This is the medial head of the gastrocnemius muscle and the anterior and posterior horns of the medial meniscus. Now we're gonna see some tendons around, and this one, the first one, this belongs to the semimembranosus muscle. Remember, it reinforces the joint from behind. And the other tendon, which also descends down here, this band, it belongs to the semitendinosus muscle. And we also have the other two, the tendons of sartorius and gracilis. So it's not so difficult, as you see. You just can scroll a couple of times forward and backward and look at the structures again, practice, and we'll see you soon.